for a very nice overview of the management and cardiovascular complications in COVID-19. Our next presenter today is Dr. Sameen Siddiqui. And Dr. Sameen Siddiqui is the Professor and Chair Department of Community Health Sciences, Afan University, Karachi, Pakistan since 2018. Earlier, Dr. Siddiqui was appointed as Senior Advisor to the Federal Ministry of Health of Pakistan in April 2019. From 2002 onwards, he worked for WHO, where he served as Director, Health Systems Management, Health Systems Development in the Regional Office in Cairo. Dr. Siddiqui has a fellowship in internal medicine, master's degree and fellowship in public health from UK and doctoral degree from Heidelberg University, Germany. He has worked for over 2 decades in health system development and has special interest in health system governance, quality, safety of care, private health sector and public-private partnership. Dr. Siddiqui has over 70 publications and book chapters, is a reviewer of several international journals and is on the editorial board of the Eastern Mediterranean Health Journal. Dr. Siddiqui will be talking about responding to COVID-19 pandemic, testing resilience of health systems.
So, Bismillahirrahmanirrahim, and thank you very much for the introduction, Dr. Tariq and Dr. Tasha, for inviting me for this talk. So, colleagues, it's a pleasure always to come and give a talk. And today, of course, I'm going to be talking, as always, on something which is non-clinical. And so you have to now switch gears in a sense and now start thinking about more public health and health systems aspects. And my talk will be around, I have how much time? 20 minutes? 20 minutes? Okay. That's good. So this is the disclosure statement and that I have no competing interests. Now, what are the objectives of this session? So we will talk a bit about what are health systems, and it will be my job in the first part to share with you when I talk health systems, what is the meaning of the word health system and how do we look at it. And then we will look at the health system's response to the COVID-19 pandemic and how does the health systems relate to our response. Then we will talk briefly about what is a resilient health system and how does it respond in crisis situations. And then in the second half of my talk, we will try and apply what we learned in the first 10 minutes to the situation of COVID in Pakistan and how the Pakistan's system of health system has actually responded to the whole challenge. So that will be the way that this talk will sort of go across. So I don't need to explain. I'm sure that we are coming to the end of this course. You have heard so much about COVID-19, coronavirus disease. There are all sorts of names that you can use, and I'm sure you know what it is, where it came from. I have a video, but clearly I will not spend my time explaining to you what COVID-19 is, because by now I'm pretty sure you would have become experts on this, you know. So with that said, let me start with what is a health system, because this talk is around COVID's or a health system's response to managing COVID in any country, and that is in Pakistan. So if you look at this framework, which is a WHO's health system framework, I want you to focus on the left side of this, and it has got 6 blocks, and they are service delivery, health workforce, information, medical products, drugs, vaccines, financing, which is about mobilizing money, and of course leadership and governance. So remember these 6, they constitute what are called the building blocks of the health system. And if these function well, then we have often good access, coverage, quality and safety, and ultimately it of course leads to better health and more responsiveness. Now my talk will focus on the 6 building blocks, so do remember these at least for the moment, that I will be touching on what is service delivery, what is workforce, information, technologies, financing and governance, and we will see the relevance of each one of these to the situation of COVID in any country, and later on we will try and use it for the Pakistan basically. So now let me pick up these things. So if we are going to start looking at, and I've added infrastructure, so clearly in order to respond, you know, you need to have a network of hospitals, you need to have primary care facilities, and within hospitals you need to have not only general beds, but you need to have step care beds, intensive care beds, and so on and so forth. And of course, you need to have screening clinics. So you need to have that infrastructure, whether it is in an urban situation or a rural situation. Of course, you just heard Professor Zainab Samad talking about the cardiovascular aspects, and clearly you need some medication. So you need essential medicines. Now we know that medicines are emerging. You just about remdesivir. You heard about dexamethasone. There are new drugs being tried. There are new vaccine trials that are going on at the moment. And although we don't have a vaccine now, but it's quite possible that we will have a vaccine early next year. You need all sorts of things like supplies, personal protective equipment, because without that, could you provide healthcare, and the safety of the providers and the physicians and the nurses and the allied staff is so important. You of course need a set of equipments and supplies in terms of ventilators, monitors, ICU facilities, and also you need a lab backup and support basically. So this I'm discussing with the function. If I talked about technology, so this is the building block of technologies that I'm talking about. So you need that kind of infrastructure in terms of vaccines, medicine, supplies, equipments, lab, and of course you need good information technology support to be able to have good connectivity, to be able to connect and communicate more effectively. So keep in mind that if you were to mount an effective response to COVID-19, you need the correct set and mix of information and technologies basically. Let me now pick up the second block, and that is about the workforce. The workforce is called the engine of the health system. Without the workforce, there is no way that you will be able to, no matter how powerful the infrastructure is, if you don't have workforce and if you don't have the right skill mix and the right capacities and the right numbers, then you will always have challenges. And of course, in case of COVID-19, you need to have the right capacity of physicians, nurses, and paramedics who are really trained in screening and managing COVID cases, both at the ambulatory level, emergency level, inpatients level. You also need, for a certain proportion of these patients, intensivists who are trained in acute care and intensive care. I mean, you don't want to have physicians or people who do not, for instance, know how to run on ventilators or manage an ICU facility. We also know that COVID has produced the challenge of mental health problems and stress, and so you need psychiatrists and you need clinical psychologists to be able to address those mental health challenges. You need microbiologists and virologists for lab diagnosis. You need managers for managing all of what I've just said. And not to forget that you need public health professionals who have been doing a lot of work in this area, both in epidemiology, predictive modeling, health education, planning, programming. So you can see you need a whole repertoire of these public health professionals or health workforce to be able to mount an effective response against COVID-19. Then you need information. I mean, COVID, on a daily basis, countries globally, locally, nationally, information about COVID has been made available to everyone, to the general public, to the media, to the providers, to the planners, to the policymakers. And if we did not have that facility for information, we would have had a major challenge, in managing COVID-19. And so you need disease surveillance where you could notify suspected cases. You need surveys to be able to assess the epidemiology of the disease. So we need, for instance, these days, Pakistan has just had a surveillance survey to be looking at the level of immunity of the population. You need information systems, and to support that, you need the right hardware, software, and connectivity. So do not underestimate the importance of information in being able to mount an effective response against COVID. So far I've talked about 3 of the 6 building blocks. I've talked about technologies and medicines and supplies. I've talked about the workforce, and I've talked about the health information. Let me now quickly move to the 4th one, and that is, if you may have everything, but if you don't have a way of governing and managing it, and if you don't have a team which provides a direction, then things can go haywire. So you need clear strategy and direction. And this is, of course, the responsibility primarily of the government, but government not alone, because you need partnership and coordination. You need the private sector, you need the non-government organizations, you need the development partners, and academic institutions. And I have to say that as Aga Khan University, we have been quite heavily involved with the government in partnership and coordination, in supporting the government in their response to COVID. And you need a system of accountability, and then you monitor in terms of whatever you plan and whatever you make decisions for, is it happening, is it making a difference, and so on and so forth, basically. The next one and is the fifth building block, and that is about money. I mean, unless you have the finances, it's very, very difficult to be able to effectively manage and tackle COVID. And so countries have spent millions and billions, in some cases hundreds of billions of dollars, including Pakistan, which has, of course, given its financial constraints, spent a lot of money to be able to address the challenge of COVID. So you need to see, do you have emergency funds? Or if you don't have, then you unfortunately have to draw your funds from other sources in the health budget. Or you have to look at other domestic sources. Or you have to rely on external assistance. I mean, countries have relied on bilateral support, or World Bank support, or Asian Development Bank support. And of course, there's been a lot of philanthropy where funds have been made available as a result of patronage and goodwill and altruism. But clearly there has got to be a way to mobilize finances to be able to run a response. And the last of all is, of course, how do you translate all this into effective services that are accessible, affordable, of quality, and can be, and are effective, basically. So you need to provide critical care services. Of course, you need to provide inpatient services and ambulatory services. You need to provide screening and isolation and quarantine services, and lab testing services, and of course you need to provide health promotion and education. So you can see just for one disease the range of services, and unless all of this comes together well, there will always be a challenge in providing effective, timely, efficient services to the population that is in need, both be those who suffer from the disease or those who are at risk for this. So that's a quick run through of what are the 6 building blocks and how each one of it is needed to be able to provide, to support what you need to do in response to COVID. But just that is not enough. You also need to do much more than that. Just these 6 things that I've mentioned is not adequate. You need to have an effective, organized, receptive community. You need to be able to refer people. You need to have travel health assistance. For instance, and I will talk to you, I'll share with you the experience. You need to have your airports and your seaports and your land ports, wherever people are coming in, where you have good surveillance and you ensure that people do not cross borders into your country when they are actually infected, and if they are, they should be screened. People need to be living in camp situations. You need to evacuate populations. You need also shelter for these people, water sanitation, transport assistance, and as I said earlier, psychosocial assistance. So there's a whole range of things that need to be done, and that is how countries have mounted or done an effective response against COVID. From a community perspective, of course, the government or the providers or even the private sector cannot do it alone unless the population and the community is receptive and responsive. So unless the community is willing to do or implement social distancing or personal hygiene or hand washing or self-isolation when exposed or quarantine when diseased, all these are absolutely essential. On a voluntary basis, you need to stay at home, or sometimes you need to do some self-lockdown. And of course, in extreme situations, in some countries, and I think one of the most forced lockdowns that was done in COVID history was in India, which unfortunately was not a very positive one because it had some serious consequences. And some countries also had to put up a curfew just to make sure at the peak of the disease that it doesn't happen. So I've run through very quickly what the amount and the range of responses that are required to be able to make a difference to the whole pandemic of COVID at the country level. Of course, all of this can all translate at the global level as well. Now, a resilience, so if a health system is being able to effectively respond to this challenge, I would call it a resilient health system. And if it is be able to respond to this in the crisis and its aftermath, then it is. Such a system, of course, brings benefits not only for the crisis, but even in times for later on. And that is what is called the resilience dividend, of course. And of course, when a system does not respond to that, then it's still not being resilient. It is a more of a disrupted health system, and that's what we don't want to have. Now, in the second part of my session, and I will focus more on all what I have said in the last, 10, 12 minutes, on what happens and how Pakistan has responded. So it's a bit of a historical thing because it all started in February when we had, on the 26th of February, when we had our first case of COVID that was detected. And clearly, government in April, for instance, and you have to go back a certain month, immediately, expanded the number of ICU beds across the country, and almost 5,000 beds were activated. And if you recall, isolation centers were created. In Karachi, the Expo Center, and in Lahore, the Expo Center were converted into isolation centers. Even the railway in those days actually opted and provided coaches to make them available for providing beds in an emergency situation. India did the same, by the way, in terms of their railways. Similarly, hotels, which were pretty much empty in those months and days, were asked to provide all their beds in case that we need quarantine facilities, and the hotels will be used. And as a matter of fact, a good 50,000 beds were made available in that way. And the government also established a telemedicine portal. So not only that, in those periods, and you remember, and you have to recall, the peak in Pakistan was in June, July, particularly in the month of June, and there were challenges of having shortages. Remember the workforce part, and I said you need workforce with the right skills and numbers, but that is not necessarily the case, and that was also the situation in many countries, including Pakistan, where we had shortage of health professionals, particularly nurses in the public sector were short of supply. So you need those kinds of things, and not only that you need to have the workforce, you need to ensure protection to that workforce. Because in the initial part, many of the workforce actually got infected because they didn't have enough PPE or personal protection equipment. And you can see the photo that in the earlier months there was some sort of a protest in Quetta. A figure that I can quote to you from Bangladesh. In the initial months, 11% of the total infections of COVID were in the health workforce in Bangladesh. And that's high. Every 10th health worker had an infection, of all those. So there's a lot of that needs to be done in terms of the workforce in order to be able to provide those services. Then you make things available in terms of medicine, supplies, and technologies. I remember in March, we were running short of masks. They were not available, not only for the general public, but they were not even available sometimes for the providers. Respirators were not there. There was shortage of COVID testing kits. And so I have to acknowledge that the government has been able to launch a fairly effective response to be able, in a short time, to be able to overcome the shortages. And despite the initial shortages, I think the response was quite positive. Similarly, protective gear was made available. The government procured a lot of over 2,000 ventilators, and many were made available on a very short notice. 50 lab facilities have been established, and I can tell you that in April only 2,000 tests were being done, but it really was increased to 40,000 in June. And currently we are doing about 25,000 tests per day for COVID. Now it is insufficient, but it was done, amounted quite well. And then there were, of course, challenges of these drugs like remdesivir, and they were not necessarily available. So you've got to see, and in Pakistan, while I think the government, despite all the challenges, did a good job, there were shortages in various areas. Now, I don't think whether this will show or not. Let me give a try, whether it shows. So in terms of the health information systems, and I told you how important it is, no, it doesn't work, so I will not get into this, because although it would have shown on my own computer, but it doesn't show it here. So the NIH has created a website, and that website actually provides you live information on what's going on a daily basis in the country, and that I think has been quite helpful. Similarly, the WHO produces on a daily basis what it calls a SITREP. A SITREP is a report, which is a situation report for COVID. And I have these here, but unfortunately, I don't think they're going to be shown here. So you'll have to but you can access them, Similarly, many institutions, including ours, were involved in modeling for COVID-19. How much will it take place? Will it happen for another 3 months, or 2 months, or 4 months? And what does the government, so that the governments can plan? We also did some knowledge attitude practice studies. And I would very much encourage you also to access the Johns Hopkins global site, which provides some amazing updates on what is happening on coronavirus across the world. So the information part, of course, is as important, and I think the government, the NIH in Pakistan, has done a pretty good job in providing live and updated information on a daily basis. Then comes the question of financing. As I mentioned to you, you need money. And just to give you a few tips on that, so in the initial months, the Sindh government mobilized about 7 billion rupees to be able to combat COVID-19. and they were given to this department, and I think they did a fairly good job in that respect. The federal government mobilized a lot of money, 1.2 trillion. If you translate that into dollars, it's about $7 billion. So a country like Pakistan, $7 billion is a lot of money, and this was not just for health, but it was to provide social protection to the vulnerable and the economically hurt segments of the population. Even there was a Corona Relief Fund in those years. The World Bank provided $200 million. So I'm just giving you that the amount of money that was mobilized is quite important if health systems have to effectively respond to crises of the nature and of the magnitude of COVID. Then not to forget the governance part. And I think in this particular case, the whole governance has been led from the very top, and that is by the Prime Minister of this country. But also the Ministry of Health produced a national action plan, which has been quite useful, and it was a pretty useful document. But one committee or one center which has done a good job, and I would believe, is what is called the National Command and Operations Center, or the NCOC. You may hear about this in the news. Now, why I say it was good is that it brings the public sector, the civilian sector, and the military together to work and mount a response. The Ministry of Health, other ministries, armed forces, and National Disaster Management Organization, and they meet on a daily basis. They are in touch with the provinces, and they have been able to secure a lot of information and provide a lot of support, financial as well as material support, to be able to do that. And I think, while I'm not particularly, I would like to say that this time the collaboration between the civilian government and the armed forces was quite productive, and I think it did help in addressing the challenge. WHO also had its advisory group, and I was convening that group actually for WHO to be able to advise through us to the government, and many standard procedures established and so on and so forth. So I'm now coming to the end of my slide. I have just a couple more slides, and so at the same time, a lot of community responses were required. So the lockdown was introduced, although it varied. But remember in earlier months, if you remember in early April, there was a big gathering in Raiwand, a place where religious gatherings take place. And ultimately, about 10,000 of those people had to be quarantined or had to be put in isolation so that they may not become a super spreader in the entire community or in the entire country. The congregational prayers were restricted in mosques, and a lot of SOPs were introduced. But the key point is the compliance of the community, and no government can do it without the support and cooperation and the compliance of the people. And I think in that respect, it was a mixed response, but many people actually did adhere to some of these restrictions that were imposed in those years and months, And then there was those lockdowns, which I'll not talk about. I would like to talk a bit about the restrictions at the point of entry, and I do want to say, although I have a video, which I don't think I can show you here, but I have a video of what happened in February, March at the Iran-Pakistan border at Taftan. And I think that was a watershed moment, because a lot of people with infection were crossing over from Iran at that time, and good surveillance and good restriction of people at these points of entry, which I referred to you earlier, could have made further a big difference to how the whole epidemic, rolled out or played out in Pakistan. This happened in the month of February, and I think that was pretty much a major challenge. Now today, where does Pakistan stand? And I think Pakistan, thankfully, with the efforts of the government and the people, and thank God that we have passed the peak. Having said that, and so if you look at the right side of the 29th of August, we had just about a few hundred cases. Having said that, there should be no false sense of security that things are good and we are behind and we are doing better than our neighbors. Well, all right, but I can assure you, if we do not adhere with the restrictions, if we do not practice social distancing, if we do not practice use of masks, if we do not do hand washing and all the precautions, then there is a potential of a resurgence of the disease. And early indications are that the numbers are somewhat going up. And so I would very strongly convey the message that we must not ease down any of our restrictive measures at this point in time. There are some predictions that we might have a resurgence in November, and for that I think we need to be prepared, and that's why I'm giving you this warning about how COVID is going to play out if we do not take the necessary measures. So to close, I think we need a coherent national response, and I talked about that. We need effective, and because we are a devolved country, so we need all our federal and provincial governments to come together well and work in a coherent manner. We need effective reinforcement of preventive measures, and I've talked about that. We need effective use of technology for contact tracing. We need to improve the levels of preparedness by fixing gaps in our infrastructure, and I talked about that earlier as well. And not to forget that the role of the private sector is critical. Aggressive testing followed by serosurveillance. The more recent serosurveillance studies in Pakistan have shown that at the moment 14% of the urban population has an antibody and about 11% in the rural population has an antibody level. So to what level of that is protective, time will tell us, but that's where we stand. And of course, we need to stay the course on social distancing and avoid premature relaxation, as I said. I'm going to stop here. I want to thank you, and I don't know whether there's time for questions or not, but if there are, and if there's an opportunity, I'm happy to answer those. So thank you very much.
Thank you, Dr. Sameen. There are a lot of questions. So we will start asking them one by one. Can I please request Dr. Asad to join too?
Okay.